started when I was an intern. It was at Western General Hospital, it was called then. And whilst I enjoyed medicine, I kind of liked the surgery because it was more doing something rather than waiting until something happened, which is, I know it's not quite accurate, but I felt like I was actually getting in there and doing something, or at least the people I was training with were. I really liked anatomy at medical school. It was my favourite subject. So, and I was actually had the advantage, benefit of teaching anatomy both at Monash University and at Stanford University in California. And that basis of anatomy, it's a really good background for surgery, and I think it's a good follow through. And it's sort of one of the things that I feel is a pity in medical school that they don't teach anatomy per se anymore. And I often feel that is a disadvantage to people wanting to do surgery. As far as the obstacles are concerned, funnily enough, I didn't have a lot of external obstacles. So the people that I worked with, both as a medical student, a resident and a registrar, were very supportive. I mean, all of my mentors were men, and they were incredibly supportive of what I wanted to do. I decided to do orthopaedics because when I was a resident, my registrar at the time, who was the orthopaedic registrar on the training program, said to me, you like this, don't you? Why don't you do it? And I said, oh, that's great. I mean, and he was, well on his way to becoming an orthopaedic surgeon, so he wasn't pulling the ladder up by any means. I was really quite impressed by that, and I thought, well, why not? So then, I decided to go on from there, and so I don't really feel that there was a lot of obstacles as far as external influences are concerned. My main obstacles were mostly internal or from me. When I decided to do surgery, you've got to sit the first part exam and the second part exam, and I managed to fail both of them. And it's a very difficult thing, because failing an exam, the obstacle is not failing the exam, because, and speaking as I know, because I've been an examiner for 8 years now, and I know that people that fail the exam, they usually pass again the subsequent sitting. So it's not the failing that should be the obstacle. The obstacle in that situation is the belief that you're good enough. And that's the problem I had, that when I failed anything, I failed my driver's license too, when you fail anything, you sort of think, am I doing the right thing? Am I good enough for this? And look, it's a really hard obstacle to get over, to believe that you're good enough, because you are. You are good enough, because you haven't got this far by not being good enough. Of course you're good enough. You just, have to buckle down and learn to do the things that you're not particularly good at, like, answering multi-choice questions, or, interviewing, or getting your mind in the right order. There's a few things that you can get better at, but you're not a failure, and it shouldn't be an obstacle, and yet for me, it kind of was. They're much better than people of my era in valuing the non-surgical part of medicine. So things like, teamwork, involvement in teaching. I just think that when I was younger, what we did was we did our fellowship, and then we usually went overseas, and you came back and you gave a presentation on whatever that you'd been studying overseas several times at various meetings, and then you tended to withdraw, and you built up your business and you built your family. And it wasn't until you were well established that you got back into doing the voluntary stuff, the committee work, teaching, all that type of stuff. These days, there are so many more younger surgeons on committees and doing the teaching and doing the presentations. And I think that that's a really good thing. And I think that the thing that you've got to be a little careful of when you're doing that is work-life balance, of course. But I think it's really good that they're participating and volunteering more, because I think that's kind of what's taught by the AOA now, that it's sort of a holistic lifestyle, if you will. What else? No, it's just that I just think that younger people these days are better than we were at giving back and giving back earlier. Now, I mentioned work-life balance, and I think that the younger surgeons are better than we were, but sometimes I know people that do a lot of volunteering, and you've got to be very careful not to overcommit. And I think overcommitting causes burnout, and then by the time you're sort of 45, you've had enough of everything and you don't do anything just when you've actually got time to do it. So I think that's the first thing. But I think the thing that I find as a head of unit, the things that I have to instill into my younger and to some extent my older surgeons is an element of common sense. And it takes a long time to learn common sense. It's things like understanding the importance of truth. So, for instance, if they come up to you in theatre at 5 o'clock and say, how long will this case take, this next case? And you go, I'll be finished by 5:30. And you know very well you won't be finished till 7:30. You might be giving that one patient an advantage, but you're disadvantaging the next 6 months of patients because no one's ever going to believe you again. So it's just, short-term gain for long-term loss. Things like picking your fights. If you're the type of surgeon that needs your special tail clip bone holding forceps, but you need to have the same team with you the whole time, and you need your country and western music playing, and you need your brown-handled mallet. If you need that to operate, then you're not going to be very good at your job. I mean, if somebody says to you at the beginning of the case, I'm sorry, we've only got the black-handled mallet, there's no point in putting your foot down and going, I can't do this case. And yet I've seen people do it. However, on the other hand, if they come up to you and say, I've only got the left prosthesis and you're doing it right, that's the time you say, okay, I can't do this case. And so you've got to save your fights for the important things. And again, it's a sort of balance between short-term gain, longer-term strategy. And that's something that everyone's got to learn, but it's easier if you learn it young so that you can practice it all the way through your work life. My main focus, I suppose, family. I've got 2 grown-up children and I love spending time with them. I have a relatively new dog who gets me out and about because we live down at the beach now, so we're walking on the beach with the dog, which is just lovely. I like cooking and I like travel. And I like to stay fit. So, if my dream holiday would be like a walking holiday across Spain, stopping at restaurants and things, it would be really great. So that, I haven't got any particularly interesting hobbies, but I do, and I enjoy reading. Reading is good. And I now that I'm living about an hour away from work, I listen to sometimes podcasts, but mostly I listen to novels in the car, and it's my time. It's great. So I'm asked this a bit, but I think, there are a lot of different answers that I've given, but the thing I think I want to say now is don't try to be a man. We're told we are at a disadvantage when you're looking for selection on committees and representative roles, but I disagree. I think that I think there's been quite a bit of work done on the different way women think compared to men. And I think that any committee or cohort is at an advantage with a mix of genders rather than all one gender. It's not about fairness, it's about quality of product. So, for example, in a high-end restaurant, if you look in the back room of the high-end restaurant, you've got a mix of genders, a mix of ethnicities, a mix of education level, mix of attitudes. Why wouldn't you draw from a big pool like that to get a really high product? And that's a really high quality product. And that's kind of what we should do. I think the message is, don't be afraid that being a woman you'll be at a disadvantage, because as a woman, you are rare and a rare, valuable commodity on many teams, on many committees. And I think that you've got to think about that. You're not at a disadvantage. You are required, you are rare, you're an enormous value. How long have you got? There's lots of movies, and I don't think I want to tell jokes here. Nevertheless, I'll tell you about my books. So I've had a bit of time to think about it, obviously, and my book preferences change as I got older. So in my teens, I was reading Tolkien, The Once and Future King by T.H. White. In my 20s, I was reading Ayn Rand, The Fountainhead and Atlas Shrugged. In my 30s, I was doing orthopaedics, so I think Hoppenfeld mostly, which, after that, I started reading some interesting things. Funnily enough, I read Homer, and I'm not a particularly academic person, but the Odyssey and the Iliad, absolutely fabulous. And it's like war in poem form. And not only that, but it's so beautifully anatomical. So there's a description in, I think it's the Iliad, of a spear going through someone's hip, and he describes beautifully the division of the ligamentum teres, all in poetry. It's fabulous.